Hello, and welcome to another edition of the Eye Associates Sight for Life and so much more. I'm Jill Graw, Patient Care Coordinator at the Eye Associates. The Eye Associates specializes in restoring and improving sight. We take great pride in our vast knowledge, educational standards, and quality patient care. I'm proud to say that we have been repeatedly chosen as best ophthalmologists, best optometrists, and best eyewear by our community. Today, we will be talking about macular degeneration, the leading cause of vision loss in adults. But the good news is that there have been some great advancements in technology relating to macular degeneration, and we are now able to preserve more vision. Here to talk about that is Dr. Joshua Malley, a fellowship-trained retina specialist at the Eye Associates. Dr. Malley, welcome.
Thank you.
I know that you are a contributing to medical journals, including Ophthalmology Times, JAMA, and Retina Today. But can you tell our audience a little bit more about your background?
Thank you, Jill. It's an honor to be here, and thank you for having me. I did my undergraduate and medical school training at West Virginia University. I went on to do my ophthalmology residency training at Albany Medical Center, where I served as chief resident. I stayed on board and actually did my medical and surgical retinal fellowship in Albany, New York as well, at Albany Medical College, where I served as assistant professor of ophthalmology. And now I'm currently, have joined the Eye Associates as the retina specialist here.
Well, you know what, Dr. Malley, I'm going to brag on you just a little bit more. I know that you graduated summa cum laude from Western Virginia University, and you were one of the first retina specialists in the United States to use a new steroid implant for diabetic macular edema. Would you tell our audience a little bit more about that?
Sure, Jill. I take pride in trying to be on the forefront of new therapies and treatments for my patients, and the Illuvian implant was actually an implant designed to last up to 3 years in patients with diabetic macular edema and that have visual loss from diabetic retinopathy. So it's a really new and exciting treatment that it's been such a pleasure for me to provide that to my patients, and they've really benefited from it.
That's exciting to get to use a new medication.
Yes.
Dr. Malley, why did you decide to become a retina specialist?
Well, Jill, I actually come from a family of physicians, so I knew I always wanted to be a doctor and help people. And actually, ever since I was younger, I was always fascinated with the eye. And I actually, prior to my residency training, I participated in several mission trips with patients with eye conditions, and I said, wow, this is what I want to do with my life. And it's been such a rewarding experience to help patients with retinal conditions and help them through scary times and help recover vision for them. So for me, it's just an honor to be able to help serve the patients of our community.
I know one of the things you told me was you really enjoyed helping your retina patients through this journey.
Absolutely.
Well, that's very special. So tell the audience, Dr. Malley, what is the retina?
Well, the retina, it's actually neurosensory tissue, or brain tissue actually, that lines the back wall of the eye. So actually the way I like to describe it is, think of the eye as a camera. So in the camera you have the lens of the camera that actually helps focus light onto the back of the eye, and the back of the eye has the film, which is the retina. And that's that very sensitive brain tissue that actually helps transmit the images that are received from the lens and transmits them to the brain where they're processed and organized, and that's the vision that we see every day.
Well, now, Dr. Malley, I know we're talking about macular degeneration. So then what is the macula?
Well, the macula is actually the very center of the retina. So that we have that picture on the screen that shows the very center of the retina, and that's what we call the macula. And that's the most important area of the retina for vision. So this is the part of the retina that helps us to see everyday things, like helps us read, helps us drive, and even helps us see our grandkids. So it is the most important area of the retina for vision.
So then what is macular degeneration?
Well, macular degeneration is a condition where the retina slowly deteriorates over time. And this is caused by several factors, and it's essentially a breakdown of the retina over time.
So now I've heard the word drusen. So what is drusen then?
So drusen are little deposits of waste material that form under the retina in that very sensitive area of the retina that I mentioned before called the macula. So you can imagine when you get a buildup of waste materials under the retina, it causes it to slowly degenerate over time and eventually break down and cause visual loss in patients that develop this condition. And that's the vision that patients lose with macular degeneration.
Well, now, Dr. Malley, is it true that actually macular degeneration is a growing problem?
It's a huge problem, Jill. And actually, in the United States, it's really a growing epidemic. In the year 2010, there's an estimated over 2 million patients with visual loss from macular degeneration. That number is actually going to increase to over 3 million Americans with visual loss from macular degeneration. And actually, it's going to exponentially jump to over 5.5 million Americans with blindness from macular degeneration in the year 2050. So it's really an epidemic problem that we have not only in our country but in the world. So it's really important to diagnose this problem early.
Well then, how would I know if I have macular degeneration?
Well, Jill, that's a very good question. Really, in the early stages, sometimes patients don't have any symptoms. They have very mild changes. But usually in the later stages, patients may develop certain visual symptoms. And these include blurry vision, blank or black spots in the very center of their vision, or even waviness or distortion in their vision.
Well now, are there different types of macular degeneration?
Yes, Jill. We actually classify macular degeneration into two categories. There's the dry type and the wet type. In the dry type, these are the changes that we actually mentioned previously with the drusen and the overall breakdown of the retina in the macular region especially. And those are the changes from the dry type. Now in the wet type, you get the changes from the drusen as well, but you also get a growth of new blood vessels that actually grows under the retina. And these are not normal blood vessels. These are actually abnormal blood vessels that tend to leak and bleed right in that macular region where you can get scarring and very sudden and very devastating vision loss. So it's a really severe condition.
So then what would be the signs and symptoms of wet macular degeneration?
Well, that's also a very good question. And one of my patients actually described it very nicely. She said that, one day she was actually coming down to her kitchen, and on the floor of her kitchen, she has these nice straight tiles that are on the floor that line the floor of her kitchen. And she said that one day she noticed that in her right eye that those nice straight tiles were not straight anymore. They're actually wavy and distorted. And she knew something was wrong. And she actually came in to see me that same day, and I was able to diagnose her with wet macular degeneration and get her treatment.
Now, can you have a sudden onset of vision loss?
Yeah, sometimes you can get a very, very sudden vision loss that's very sudden and really can be devastating and noticeable to patients. But as I mentioned before, sometimes you may notice very subtle changes. So maybe you look up at your blinds on your window and, something's funny. They're kind of not as straight as they usually are, and they're wavy or distorted. And that can definitely be a sign that something has changed and needs to be examined.
Well now, if I have the dry form of macular degeneration, what would be the chance of me developing wet macular degeneration?
Well, that's a good question. It's really, it's based on the risk factors that each individual patient has. And, we kind of are able to grade patients on a spectrum of disease. And really the only way to kind of figure that out is actually to come in and have a dilated eye exam and for us to examine your retina and able to classify you and give you a sense of your risk factors and how likely you are to develop the wet form.
Well, now, Dr. Malley, I hear that there's some great news for wet macular degeneration patients, that there's some great new treatments, and that you're actually able to preserve more vision now. Please tell the audience more.
Absolutely, Joe. It's very fascinating. As many of our audience members may know, years ago, patients with wet macular degeneration went completely blind, and there was no treatments available at that time. And actually, an interesting story that I can think about is actually a son of a patient that I have he says that his father went blind from macular degeneration, and he was so scared and so terrified of going blind. And so he actually developed wet macular degeneration, and I was able to get him early treatment, and he's so happy now that he's even able to drive to his own appointments by himself, and he's just really excited that he's able to benefit from these treatments that his father never had. So we're really blessed to live in such a time where we have these treatments available.
No wonder you enjoy being a retina specialist.
Yes.
Dr. Malley, how do you decide, though, which injectable is right for the patient?
There are several injectables that are available on the market today, and really the way I look at it is I really customize my treatment to each individual patient. So I really like to sit down with each patient, explain to them their diagnosis, explain to them their risk factors and their exam, and come up with a plan together in a very team approach. And that may also actually involve a family member or several family members in that decision-making process. So I really like to involve the patient and customize their treatment regimen to each individual patient.
Well, the Eye Associates is known for their customized vision. It's not a one-size-fits-all for all patients.
Yes.
So, Dr. Malley, is there any way that I could test my own vision to see if I have macular degeneration?
Yes, Jill. I actually recommend that all my patients use something called an Amsler grid. And we're actually going to show one right now.
Okay.
So, this is a Amsler grid. So essentially what it is it's a lined paper with a black dot right in the center. Okay, so this is a grid paper. Essentially it's a self-check to use for patients to use at home in between appointments. So essentially what you want to do is you want to place this grid paper somewhere where you're going to see it every day. So for example, some of my patients put it on their bathroom mirror or their refrigerator, somewhere where they know they're going to pass by it every single day so they can make sure to remember to use it. So what you want to do is you want to make sure to, put on your glasses. So if you use reading or distance glasses, to make sure to wear those. You want to make sure there's good lighting in the room. And we're actually going to demonstrate the process right now.
Okay.
So Jill, if you don't mind, I'm going to have you
Be glad to help
assist me here. So again, this is the grid paper that's going to be sitting either on your bathroom mirror or your refrigerator, again, somewhere where you know you're going to see it every single day. And you can see I have my glasses on, and we have good lighting in this room. And you want to make sure to check each eye individually. So I'm going to cover up my left eye really good to make sure I'm only looking out of my right eye. And what you want to do is you want to focus right on that black dot in the center. And you're going to see those lines, the grid paper lines around it. And you want to make sure that all those lines are nice and straight. If they ever become wavy or distorted, that can mean that there has been a change that is occurring. And you want to test each eye individually. So I test my right eye first, and then I switch hands and I go to the other side and cover up my left eye really good and look with my left eye right at that black dot and make sure the lines are nice and straight. And again, you want to check each eye individually, and it's really important to do this every single day to help monitor yourself at home in between appointments so you can have essentially a self-check at home.
Well, and I want to let our audience know if you'd like to have your own Amsler grid, you can stop by any one of our offices and pick up an Amsler grid free, or you can actually go to our website at theeyeassociates.com and actually print off your own Amsler grid and have your own at home. So tell me now, who is most at risk for macular degeneration?
So there are some risk factors that we do know about that are associated with macular degeneration. The first one is age. We know that with advancing age, the retina deteriorates over time in patients with macular degeneration. So age is definitely a risk factor that we do know about. The next risk factor is there is a genetic factor. So it actually tends to run in families. So you may notice that patients with family members with macular degeneration similarly have the same disease themselves. So there is a genetic component that we do know about. Another risk factor is actually an environmental one, that one that we can actually control, is smoking. We definitely know that smoking can progress macular degeneration and make it worse. So I always encourage all my patients to make sure they stop smoking. And finally, we see macular degeneration more commonly in patients with fair skin.
So, Dr. Malley, then there is a hereditary factor to macular degeneration.
Yes, Jill, there's definitely a genetic component to macular degeneration, although not always. Okay, so for example, I actually had a patient that I had seen a while back that she came in. Her father's actually was a patient of mine, and he has macular degeneration, and she came with him to the appointment, and she had mentioned, you know, she asked me, should I be checked for macular degeneration? My father has it. Should I be checked? And she was about 45 years old, and I had told her, you know, I think at least I should do a baseline exam on you to see if there are any early changes. So she came in the next day, actually, and I was able to evaluate her, and she did not have changes from macular degeneration. So not always, but we do make sure to monitor patients with a family history of macular degeneration to see if we can find any early changes and make sure to monitor them for any development of the wet kind.
So it's important to have your yearly eye exam.
Yes.
Dr. Malley, why is it called age-related macular degeneration? Is it always related to age?
Well, we know that age is definitely a risk factor, and we know that advancing age causes deterioration of the retina over time with people with macular degeneration. So age is definitely an important component, but there are other risk factors that we mentioned previously that are also important as well. But age is definitely on the list.
And is macular degeneration curable?
Well, no, Joe. We don't actually currently have a cure for macular degeneration, although I will say that we've come a long way just in the last decade with new injectable treatments to treat the wet form of macular degeneration. And I'm really hopeful that down the road we're going to really find a cure. So I'm really excited about the future.
Well, are there actually ways to prevent macular degeneration?
Well, we don't know of any particular ways to help prevent macular degeneration, but there are some things I do recommend for my patients to do to help give them their best chance. So for example, as I mentioned previously, I think it's so important to stop smoking. That's the one thing we can definitely control is smoking. So I definitely recommend that all my patients make sure to stop smoking. I also recommend that patients get a good diet full of green leafy vegetables. In addition to getting regular exercise is really important for overall healthy lifestyle. And finally, I recommend wearing sunglasses to help prevent UV light exposure that can damage the retina over time.
Well, one of the things that I've recently heard about is the blue light from the LED products, that they might be harmful to the eyes. Is that true, and is that something we need to worry about?
Well, yes. You know, blue light. There have been some studies that could show a possible link between macular degeneration and blue light. So I do recommend that my patients actually help protect themselves from blue light. So here at the Eye Associates, we actually have special lenses that help reflect the blue light to help block it, and that's been a really important therapy that I help offer my patients. In addition, there's also things that screen protectors that you can get for your iPhone, for your iPad, or other technologies that have a screen that emit blue light. So I think it is an important component, and I do recommend my patients do help protect themselves from blue light.
Now, Dr. Malley, do you recommend vitamin therapy?
Well, yes, Jill. Actually, there was a large study that was done. It was called the AREDS study, so AREDS study, and it was performed to look at a certain vitamin formulation that was composed to see if that would help prevent conversion from the dry kind of macular degeneration to the wet form of macular degeneration. And actually, this is a special formulation that was designed and actually showed that in about 25% of patients with intermediate and advanced macular degeneration, that it slowed the progression from the dry type to the wet kind of macular degeneration. So there's definitely scientific evidence that vitamin therapy in a certain population of macular degeneration patients, that it helps prevent the progression.
Well, then what are the difference between the AREDS and the AREDS 2 study?
Yes, so the AREDS study was the original study that I mentioned, and it had a special formulation composed of beta-carotene, vitamin C, vitamin E, zinc, and copper. So this special formulation was looked at in that original study. After that study that was completed, they noted that the beta-carotene actually increased the risk of lung cancer in patients who smoked. So therefore, a follow-up study was done, and it was called the AREDS-2, so the AREDS-2 study, that looked at a new formulation where they actually replaced the beta-carotene with two minerals called lutein and zeaxanthin. And these two minerals take the place of the beta-carotene, and they actually do not increase the risk of lung cancer in smokers. And they actually showed that this new formulation was just as effective as the old one. So that's the formulation that I recommend for all my patients.
So then, people that smoke should take the AREDS vitamins.
Take the AREDS-2 vitamins, yes, it's really important.
And this is very important that even patients who have smoked in the past, that they use the AREDS-2.
Correct.
Okay, very important. Then there's so many brands of eye vitamins when you go to the store. How do you know what to buy?
I agree, Joe. I mean, you go to the store and the shelf is all full of different brands and different components. The key thing to look for, and I tell all my patients this, is to always look for that AREDS-2 designation, the AREDS-2 designation. It should be on the box. That's that special formulation that was designed for patients with macular degeneration. So that's the one you want to look for. I don't care what brand it is, as long as it has that designation on it, it's a universal formulation.
So what is the difference between a multivitamin and an eye vitamin?
Good question. You know, a multivitamin has so many other things in it. And again, there's that special formulation that was designed just for patients with macular degeneration. So it's really important that you get that special formulation. Now, you know, a multivitamin has other things in it and not in the right concentrations or components like the AREDS-2 formulation, but I make sure my patients take an eye vitamin, and if they want to take a multivitamin for their general health, I'm okay with that as well.
So will vitamins make my vision better? And should everyone with macular degeneration be taking eye vitamins?
So it does not make your vision better, but it does in that certain population of the intermediate and advanced macular degeneration patients, it does help that decrease the progression from the dry type to the wet type. So I definitely do recommend that my patients take that special AREDS-2 formulation.
Now, you've given us a lot of information. Can a family member come to the appointment with a macular degeneration patient?
Absolutely, Joe. I recommend that all my patients make sure to bring somebody, you know, either a family member or a loved one or you know, a friend, somebody that can help come with them to the appointment. And this serves several purposes. First of all, it's an extra set of ears that helps listen to their progress, listen to instructions, and just overall provide a nice moral support for the patient. So I think it's really important. I really stress that to my patients to make sure to bring somebody along to help along the journey.
Well, you know, Greg's mother, you know, had macular degeneration, and it was very helpful for us to go to find out what she was going through and what she was experiencing. It was very helpful. So that's great that you allow family members to come. Can someone with macular degeneration have cataract surgery? And if so, why would you do it?
Well, yes, there are situations and there's times when I would recommend that a patient have cataract surgery even if they have visual loss from macular degeneration. And basically the situations that would occur would be, for example, let's say a patient has such a dense cataract that we're unable to visualize the retina and monitor changes from macular degeneration. Therefore, that would be an instance where removing the cataract would allow me to visually inspect the retina and monitor changes. Another reason would be that possibly removing the cataract will allow more light to get inside the eye and help provide more peripheral vision for patients with visual loss from macular degeneration. And that may make the difference of helping them get around better. So there are situations where I would recommend cataract surgery.
So, Dr. Malley, what is the role of a low vision specialist in a macular degeneration care of a patient?
Well, we're so blessed to have actually several low vision specialists here in the area, and I believe they're really a cornerstone to helping patients with macular degeneration as well. They really help to maximize a patient's visual potential and use what they have, and I think that's really important, especially in this patient population. So they have all types of technologies and tips and tricks to help with maximizing their vision and helping improve it.
Now, we are so lucky to have two great organizations in the area that help with visual, our patients that have disabilities. The Southeastern Guide Dogs and the Lighthouse Minnesota. I know their services are free and they help with everyday living.
Yeah, Joe, I was actually, the other day I was actually at the Lighthouse in Minnesota, and I was able to take a tour and really view all the services they have, and it's just such a wonderful organization, and they really help patients with their daily lives and helping provide that extra help that patients with macular degeneration or patients with other visual low vision needs helps to maximize and help them live fulfilling lives.
Now, tell us, what do you think the future, how does it look for patients with macular degeneration?
The future is so exciting. Again, we've come such a long way in the last decade or so with new treatments available. And I'm really hopeful that there's going to be new developments and different medications, and all the way from systemic medications to eye drops to longer lasting injectables to even now experimental stem cell research. I think the future is so bright, and I'm really excited to be a part of it.
Now, what about the eye associates? Are they involved in studies also?
Yes, Joe. We actually have some ongoing studies that we're doing, and we're able to help enroll patients and get them involved if they're candidates. And so we try to be on the forefront of new therapies and treatments to help give our patients the best chance to maximize their vision.
Now, Dr. Malley, I know, is it important for all patients to enhance their senses?
Yes, Joe, absolutely. Another sense that we like to maximize is their hearing. I think it's really important to not only, it's our job to help with just their vision, but here at the Eye Associates, we also help with hearing. And we have a hearing specialist that's able to help patients maximize other senses. So for example, I had a patient the other day that their hearing aid was actually whistling. And I mentioned, I said, hey, have you gotten your hearing aid checked out recently? And she says, no, I haven't done it for several years. And so I actually referred to our hearing specialist, and he was able to modify it and fix it for her, and she's really happy that now she has improving sight and hearing.
Well, that's wonderful. Just to recap, people should stop smoking. They should eat healthy, exercise, and use their Amsler grid every day and get those yearly comprehensive eye exams.
Absolutely.
Well, unfortunately, we're out of time, Dr. Malley, so thank you. And thank you, audience, for joining us today. We'd love to hear from you about your questions about macular degeneration and suggestions for future shows. Just give us a call at toll-free 1-866-865-2020 and mention the TV show. Or if you'd like to make an appointment with one of our award-winning doctors, we'd love to see you. Just call the toll-free number on the screen. Our goal is to keep you seeing your best and enjoying your life. So for now, I wish you the best sight for life and so much more.